Ever wondered how mechanical ventilation works? Well, you're not alone. It's a complex process, but let's break it down into simpler terms. Mechanical ventilation is a life-saving method often employed in critical medical situations like emergencies or surgeries. Its main function is to assist those who are unable to breathe on their own, to ensure their body gets the oxygen it needs to function. Imagine this: your lungs are like balloons. When you breathe in, they fill with air, oxygenating your blood. When you breathe out, they deflate, expelling carbon dioxide, a waste product. Now what if for some reason your lungs can't do this on their own? That's where mechanical ventilation comes in. A mechanical ventilator is an external machine that helps to inflate and deflate your lungs, much like how you would manually inflate a balloon. It does this by pushing air, or a mixture of gases, into the lungs. This process is known as positive pressure ventilation. The pressure is carefully controlled to match the patient's needs, ensuring the right amount of oxygen reaches the blood. But how does the machine know when to push air in and out? Well, it's programmed to mimic the natural rhythm of breathing, inflating the lungs when you'd normally take a breath, and deflating them when you'd exhale. It's a delicate balance, finely tuned to each patient's specific requirements. Of course, mechanical ventilation isn't a one-size-fits-all solution. It's tailored to each patient's unique circumstances, taking into account factors like their age, weight, and the severity of their condition. The goal is always to support the patient's natural breathing as much as possible, while minimizing any potential risks or complications. So in essence, a mechanical ventilator takes over the body's breathing process when disease has made it too difficult or impossible for the patient to do so. It's a remarkable piece of technology, and its role in modern medicine cannot be overstated. But remember, it's just one part of a bigger picture, a comprehensive treatment plan aimed at getting the patient back on the road to recovery. Now, how does this marvel of medical science work? Well, to understand mechanical ventilation, we need to get into a bit of science. Mechanical ventilation involves pushing air into the lungs under pressure, an action known as positive pressure. This is quite different from how we normally breathe, which relies on negative pressure. Let's break it down. When we breathe naturally, our diaphragm and intercostal muscles contract. This increases the volume of our chest cavity, creating a negative pressure relative to the outside air. This pressure difference draws air into our lungs. In contrast, mechanical ventilation uses an external machine to generate positive pressure. This pressure pushes air directly into the lungs. Think of it like this: imagine a balloon. When you blow into a balloon, you're using positive pressure. The pressure from your breath pushes against the inside of the balloon, causing it to inflate. That's essentially what a ventilator does. It blows up the lungs with oxygen-rich air. This oxygen-rich air then passes from the lungs into the bloodstream, where it's carried to the body's tissues. Meanwhile, carbon dioxide, a waste product from our body's metabolic processes, moves from the blood into the lungs. The ventilator then helps to expel this carbon dioxide from the body during exhalation. But here's where things get a bit more complex. The ventilator can't just continuously push air into the lungs. It needs to be carefully calibrated to mimic the natural rhythm of breathing. Too much pressure could damage the lungs, while too little wouldn't provide enough oxygen. Health professionals carefully adjust the ventilator's settings to match the patient's needs, ensuring a delicate balance between oxygen delivery and lung protection. So, when you get down to it, mechanical ventilation is all about using positive pressure to aid in the crucial process of respiration. It's a lifeline for those who can't breathe on their own, giving their body the oxygen it needs while they recover. In simple terms, mechanical ventilation is all about positive pressure helping your lungs to inhale and exhale. What makes up a mechanical ventilator, you ask? Well, let's dive into this crucial piece of medical equipment and find out. At the heart of a mechanical ventilator is the control system. This is the brain of the operation. It's where healthcare professionals set the parameters for ventilation according to the patient's needs. The control system adjusts the flow of air into the patient's lungs, ensuring they get just the right amount of oxygen. It's a finely tuned system that can adapt to changing requirements, helping to maintain a stable and healthy breathing pattern. Next, we have the power source. This is the muscle that drives the ventilator. It could be an electrical plug, a battery, or even a compressed gas cylinder. The power source propels the air into the patient's lungs, acting as a surrogate for the muscles that would normally do this job. Without a reliable power source, the ventilator simply can't do its job. Then there are the circuits. These are the pathways through which the air travels. They're like the roads that connect the control system and power source to the patient. Circuits are designed to be clean and smooth, minimizing any resistance to the flow of air and ensuring the patient receives the full benefit of the ventilator's power. Finally, we have the alarms. These are the vigilant guardians of the ventilator. They monitor the system for any irregularities or issues that might compromise the patient's safety. If the pressure is too high or too low, if there's a disconnect in the circuits, or if the power source falters, the alarms sound the alert. They are an essential backup system that provides an extra layer of protection for the patient. So there you have it. The key components of a mechanical ventilator. The control system, power source, circuits, and alarms all work together, each playing a crucial role in ensuring the patient can breathe. They're a testament to the incredible advances in medical technology. Each piece of a mechanical ventilator has one goal: to ensure the patient's lungs receive the right amount of air at the right pressure. Ventilator settings are a critical part of this process, but what do they mean? Let's take a deep breath and dive into the heart of mechanical ventilation, the settings. First on our list is the tidal volume. This is the amount of air that is delivered to the patient with each breath. The goal here is to mimic the natural volume of air that we would inhale and exhale during a restful, unlabored breath. This is usually between 5 to 8 milliliters per kilogram of the patient's ideal body weight. It's like filling up a balloon, too little, and the balloon won't inflate, too much, and it could burst. Next, we have the respiratory rate. This is the number of breaths the ventilator gives per minute. For adults, this typically ranges between 12 to 20 breaths, but may be adjusted based on the patient's condition. It's the rhythm of the breath, the metronome that keeps time for the symphony of ventilation. Then comes the positive end expiratory pressure, or PEEP. It's a bit like leaving a door slightly ajar. Instead of allowing the lungs to fully deflate after each breath, PEEP keeps a little bit of air pressure in the lungs. This helps keep the airways open and improves oxygenation. It's a delicate balance, though. Too much PEEP might overdistend the lungs, while too little could result in collapsed airways. Finally, we have FiO2, which stands for fraction of inspired oxygen. It's the concentration of oxygen in the air mixture that the ventilator delivers. While the air we breathe normally is about 21% oxygen, the FiO2 on a ventilator can be adjusted up to 100%. But more isn't always better. High concentrations of oxygen over prolonged periods can be harmful, so the goal is to use the lowest FiO2 necessary to achieve an acceptable oxygen level in the patient's blood. Each of these settings is carefully adjusted to meet the patient's specific needs. Like a skilled conductor leading an orchestra, the clinician must harmonize these settings to create the perfect symphony of breath for each patient. It's a complex task indeed. The tidal volume and respiratory rate must be set to ensure adequate ventilation without causing lung injury. The PEEP must be high enough to keep the airways open, but not so high as to cause harm. And the FiO2 must be just right to ensure enough oxygen gets into the blood without causing oxygen toxicity. But when done correctly, it's a thing of beauty. Each breath in perfect harmony, each setting playing its part in the symphony of life. These settings, when adjusted correctly, ensure that the patient receives the right amount of air with the right amount of oxygen. And that, my friends, is the art and science of ventilator settings. Did you know that mechanical ventilators have different modes? Yes, just like your car has different gears, mechanical ventilators come with different modes to cater to various patient needs. Let's dive into the three primary modes: assist control, synchronized intermittent mandatory ventilation, and pressure support ventilation. First up is assist control ventilation, often referred to as ACV. Now imagine you're trying to lift a heavy box. It's a struggle, right? But if someone comes along and lends a hand, it becomes a lot easier. That's what ACV does for patients who are struggling to breathe. It provides a preset number of breaths per minute, and if the patient tries to breathe on their own, the machine kicks in with additional support. It's like a dependable friend, always ready to help when you need a little extra push. Next on the list is synchronized intermittent mandatory ventilation, or SIMV. Think of this mode as a dance between the patient and the ventilator, where the ventilator follows the patient's lead. In SIMV, the machine delivers a set number of breaths, but unlike ACV, it allows the patient to breathe independently in between these mandatory breaths. It's all about synchrony here, with the ventilator stepping in and out of the dance as required. This mode is particularly useful for patients who are recovering and regaining their ability to breathe independently. Last but not least, we have pressure support ventilation, also known as PSV. This mode is like having a personal cheerleader encouraging you every step of the way. PSV provides a pressure boost during the initial phase of each breath that the patient initiates. It's all about empowering the patient to breathe on their own while still offering a helping hand. This mode is often used in combination with SIMV to assist patients as they transition off mechanical ventilation. But remember, these modes are not one-size-fits-all solutions. The choice of mode depends on various factors, including the patient's underlying condition, the goal of ventilation, and the patient's response to the chosen mode. It's a delicate balancing act, requiring careful monitoring and adjustment by healthcare professionals. The beauty of these modes lies in their flexibility and adaptability. They can be tailored to provide the right amount of support at the right time, making mechanical ventilation a truly versatile tool in the medical world. Whether it's helping a patient through a critical phase or assisting in their recovery, these modes of mechanical ventilation are there to support every breath along the way. So the next time you come across a mechanical ventilator, take a moment to appreciate the sheer complexity and sophistication of this life-saving machine. It's not just about blowing air into lungs, it's about understanding the intricate dance of breath and life and supporting it with precision and care. Different modes for different needs, mechanical ventilation is truly a versatile tool in the medical world. Like all medical procedures, mechanical ventilation has its importance and limitations. Let's dive in. Mechanical ventilation is, without a doubt, a vital tool in modern medicine. It quite literally breathes life into patients who, for a variety of reasons, can't do it on their own. It's a game changer in critical care settings, where patients with acute respiratory distress syndrome, chronic obstructive pulmonary disease, or those undergoing major surgeries often depend on this life-supporting technology. The importance of mechanical ventilation extends beyond just keeping the patient alive. It provides the necessary time for doctors to diagnose and treat the underlying condition causing respiratory failure. By taking over the work of breathing, mechanical ventilation also allows the body to conserve energy and focus on healing. However, we must also acknowledge the limitations of mechanical ventilation. You see, it's not always a perfect solution. For starters, mechanical ventilation can potentially cause lung damage. This is particularly true in cases of overdistension, where the lungs are inflated excessively, or barotrauma, where changes in pressure cause lung injury. It's a delicate balance of providing enough air to sustain life, without causing further harm. Another limitation is the necessity for sedation. It's not comfortable having a tube inserted into your windpipe. Therefore, to make the process bearable and to prevent patients from removing the tube, sedation or even paralysis is often required. This, however, can lead to complications such as delirium and prolonged hospital stays. Lastly, the process of weaning a patient off the ventilator can be a complex and challenging process. The longer a patient is on mechanical ventilation, the more difficult it may be to restore their independent breathing. While mechanical ventilation is a lifesaver, it's not without its challenges, emphasizing the need for careful monitoring and management. So, there you have it, a look into the world of mechanical ventilation. We've journeyed through its fascinating science, understanding how it helps patients breathe when they cannot do so on their own. We've delved into the key components of a mechanical ventilator, from the tubes and sensors to the complex life-saving technology within. We've unpacked the intricacies of ventilator settings, learning how healthcare professionals fine-tune these machines to meet individual patient needs. And we've explored the various modes of mechanical ventilation, each with its unique benefits and applications. But let's not forget the significance and the limitations of this technology. While it can be a vital lifeline, it's not a cure-all solution. It's a delicate balance, a dance between man and machine, each working together for the benefit of the patient. Next time you hear about mechanical ventilation, you'll know exactly what it means and how it works. Until next time, keep exploring and learning.